Osteoporosis is a disease that affects approximately 10 million Americans. Another 44 million live with low bone density, placing them at a higher risk of bone fractures.
Yeah, October is Bone and Joint Health Awareness Month. Orthopedic surgeon Dr. Jacob Budny with Bon Secure's orthopedic specialist here to raise awareness about all of this. Thank you so much for being here. First question for you, just tell me a little bit about what osteoporosis is.
Yeah, sure. So osteoporosis is low bone density, which you're absolutely correct to say. So just the integrity, the strength of the bone itself. So we all peak out at our bone density at about the age of 25.
Wow.
So you can imagine that over time that will go down, and that gives us at-risk conditions for fracture. So that's the reason that we talk about this, is because prevention is really the key here.
And you said, you just caught my eye when you said that you peak out at 25. Is there anything parents can be telling their kids to do now that helps, or is this genetics?
Well, there is some genetics to it, yeah. I mean, we're all made in certain ways. That's why we look different. But ultimately, there are certain activities that we can do. Really, weight-bearing activities is really the biggest thing. So staying active is really one of the big keys to almost every orthopedic condition. And so bone density, you can train it up, too. So essentially, the more you do physically within your capabilities is generally the better thing.
When should someone seek a specialist for this?
So ideally, since osteoporosis, really the biggest problem with osteoporosis is fracture. So the ideal would be before fracture. Now, that's usually, unfortunately, the first sign of osteoporosis is that you fall and break one bone or another. And usually it's either a wrist, your vertebrae in your back, or in your hip. And unfortunately, a lot of those go on to require surgery. And so the best time, of course, is before all of that happens. So the first warning would be, if you've ever had any one of those types of fractures, reasonable to talk to your primary care physician or an orthopedic surgeon regarding workup and treatment thereof. The best time also, since some of the statistics are very important, so women are 4 times the risk of men, especially if they're postmenopausal. So it's very important to consider that in your own daily life, is where you are in sort of the metabolic trajectory. Men over 72 are at risk. Also, if you are on certain medications, things like steroids, they get a lot of press, a lot of people on them, and now especially with certain other medications, which is worth talking to your primary care physician about.
Well, we know our bones are connected to our joints. Is there anything that we can do to help with joint health?
Absolutely, yeah. So joint health goes along with all of this, is in the sense of keeping up your activity level. You know, it doesn't have to be running a marathon. You don't have to go out there and do these crazy exercises that people are doing sometimes. But for the most part, every day, get out there and do some weight-bearing exercises, not just your legs, but your arms as well. Also, too, maintaining an ideal body weight is very important, because ultimately that's more pressure, and more pressure is sometimes an issue.
Can you talk about the recent advancements in total joint replacement surgery?
Sure. So total joint replacement surgery is a little bit of a different topic, and I'm a total joint surgeon, so I do hip and knee replacement surgery. And so the advancements, really the two that I think are worth highlighting. The first is the accelerated joint replacement program, which is essentially where traditionally joint replacement has a bit of a reputation. People worry that there's going to be a much longer recovery than really it is, and so what we're doing these days is getting people up and moving the day of their surgery. Something that's surprising to a lot of people is you can walk the day of your hip or knee replacement surgery, and so we're getting you up, walking, and actually a large percentage of people are getting home the day of their surgery, so accelerated joint replacement. The second is robotics and computer-based navigation. So essentially what we're using is using a digitized world during surgery to more precisely place your hip or knee replacement.
What is the recovery like?
The recovery after a joint replacement, it can vary, obviously, for each individual. Now, in the end, I like to tell my patients that almost everybody wins. You know, essentially, we have a 95% good or excellent result after a hip replacement, 87% after a knee replacement, which means people are happy that they did it every day that they wake up. But basically, what you can think of is it's an hour-long surgery. You're up and walking that day. Usually, you can leave the hospital either that day or the next day. And then after about 2 weeks, on average, for a hip, most people will tell me that their pain from surgery is far less than whatever they had before. Same with their knee, maybe a week or two later, and then by the end of 2 or 3 months, you're living your life.
All good to go. Dr. Budny, thank you so much for being here.
Good
All
information.
great information.
Great, thank you.
My mom would probably be okay with me saying this, guys. So my mom had a hip replacement recently and loves it. Loves her new hip. She is loving it, and you can see her. She's a walking advertisement for hip replacement because you will see her out walking in the neighborhoods. She is out there, out on the street, out on the sidewalks, I should say.